So when people get sick, they often want to take medicine to help themselves feel better. So let's go ahead and start with a patient so we can explore how medications are prescribed and paid for. So suppose our patient here wakes up in the morning, he just feels a little run down, feels a little under the weather, has got a little bit of headache, maybe a little stuffy nose. Not really sick enough to go to a doctor or go to a hospital, so he just travels to the local pharmacy and then walks down the aisles and picks up a bottle of maybe a pain reliever or decongestant to help with his cold. So that is called an over-the-counter medicine because he can just buy that over the counter at the drugstore, doesn't need any special permission, and he just pays for that out of his own money. That is called an out-of-pocket expense. So it's just like any other basic consumer good. You just go to the store, you buy it, and then hopefully you're satisfied with the purchase you made. Now, on the other hand, let's suppose our patient woke up and he's got a high fever, got a sore throat, maybe his son or daughter has strep throat. He's worried he has strep throat. So he goes to see the doctor does a throat culture, says, yep, you have strep throat. And then that doctor goes ahead and writes up a prescription, sends that prescription to the pharmacy, and the pharmacy assigns that to a pharmacist, goes to the back, and comes up with a bottle of antibiotics for our patient. Now, that is not something you can just walk in and buy. You have to have a prescription, so that's called a prescription medication. Now, a prescription medication is often also has to be paid for, and usually if you have a prescription medicine, that's paid for by a combination of insurance, assuming you have health insurance, as well as some out-of-pocket contribution from our patient. And we're going to talk about that a little bit. Before we get to how medicines are paid for, I just want to give you a sense of how often people take prescriptions. It turns out that people between the ages of about 19 to 64 years old per year, on average, will get actually about 12 prescriptions. And then once you're a senior citizen, 65 years or older, that number increases. So they, on average, fill about 28 prescriptions per year. So you can see how these numbers really add up over time. So many people are taking medications prescribed by a doctor. And because those pills can become quite expensive, those medicines can start to become pretty expensive, that's why insurance was developed. And so let's talk a little bit about generally how people pay for medications. So suppose you've gotten a prescription. I'm just going to draw a pill bottle here. And you have, say, been given a 3-month supply of this medicine. And let's further say it's fairly expensive. It costs about $200. So we're going to talk about two concepts related to how medicines are paid for. A copay and then a deductible. So a copay would work like this. If you wanted to get your medications, I'll go ahead and draw this in green, a patient, I'll just write PT right here, would have to pay a contribution, say about $10. The insurance, as I draw as INS right here, would pay the balance, which is $190. So this portion right here is referred to as a copay, and the insurance company offers a $190 benefit. So if you look at the back of an insurance card or a prescription drug card, that's one of the really important pieces of information that might be on there. It'll say right there copay, and then it might say $10 for medicine. Another way a patient might have to pay for medicines is that in the beginning, the patient may have to pay all $200, and the insurance company would actually pay $0. That's just for the first prescription. But let's say this person, just like many people, has many prescriptions, and over a period of time has to purchase several of them. And after a while, it turns out the patient has paid, say, $400 in medications. and the insurance company still hasn't paid anything. But it turns out that our patient has what's called a deductible. So what happens is that after you spend a pre-specified amount, say $400, after that period of time, the insurance company now starts to kick in all the costs of the medications. So two important concepts, again, to understand with medicines and with other insurance products is both a copay and a deductible. So somebody might look at this and say, why is this so complicated? And probably the best way to understand it is that medicines themselves are complicated. So in the next video, we'll go ahead and explore how insurance companies may use copays and deductibles to help patients make better decisions about their medications.